guys, it's Khaki. Gotta love technology. This is the second time I've recorded this. I forgot to save it the first time. I would like to talk to you today about a very important topic for those of us who have had gastric bypass surgery. It is something that I feel like is not widely understood in the bariatric community and is a very, very important thing that we need to avoid. That is the use of drugs called NSAIDs. So let's talk about it. In those of us who have had a gastric bypass, we should have been told by our bariatric team that we can never use NSAIDs forever. So, what are NSAIDs? Non steroidal anti inflammatory drugs. Drugs in this class include Aleve, ibuprofen, naproxen, naproxen. On the prescription end, we're looking at meloxicam, Celebrex, diclofenac. These medications are commonly used in people with pain, in people with arthritis, in post-op patients. They work by inhibiting a chemical called prostaglandin. However, they do something else very serious in those of us who have had a gastric bypass. I'm going to talk about bypass right now. It is recommended in gastric sleeve patients to avoid NSAIDs for 3 to 6 months after surgery, but for those of us who've had a bypass, it's a forever thing. Why is this for those of us who have had that surgery? As we know, when you have a gastric bypass, most of your stomach is just that, bypassed. A very small pouch is created, which is about the size of an egg. And the top of your large intestine, or your small intestine rather, is brought up and connected to the bottom of that pouch. That area where the connection is called the margin. When you take an NSAID, as I said, it inhibits prostaglandins, which decrease inflammation, but they also affect the mucosa of your stomach. It decreases mucus production, which is protective. It also decreases blood flow, which puts you at an increased risk for an ulceration. That area where the two places come together, that surgical site in the margin, is especially prone to this type of ulcers because the skin there is thin and there is a suture line there, which is vulnerable. When a person who has had a gastric bypass takes those non-steroidal anti-inflammatory drugs, you're dealing with a very small area for that drug to be digested, so there is an increased effect. And then you've got this area on our stomachs that nobody else has, this surgical site, which is extremely vulnerable. In folks who have not had this surgery and they overuse NSAIDs, we do see ulcers, but they're usually peptic ulcers, which can be serious. But margin ulcers in those of us post-op can be life-threatening. And no one knows exactly where that tipping point is. Can these be caused in some patients by just a few days of use, or does it require a long time? Nobody really knows. There is a significantly increased risk that has been studied in patients who take them for more than 30 days. But in my personal practice, I have seen patients develop an ulcer who are post-op gastric bypass in less time. To me, this is a very real risk that a lot of patients do not understand. When we have surgery, we're given all of this information. Don't drink carbonated drinks. Don't drink and eat at the same time. Don't chew gum. Don't do this. Don't do that. A lot of those things have been debunked, or it's more of a comfort issue. NSAID use is a safety issue. It is a life-threatening issue. I want to talk to you about one example with a patient that I have had. Patient post-op gastric bypass, had an orthopedic injury, was given an NSAID. She developed serious stomach pain, went to the emergency room, had one of these margin ulcers, and her stomach had perforated, which means a hole had appeared. When that happens, the contents of your stomach or your colon go into your bloodstream. When that happens, you often get septic, which is an infection in your blood. This can lead to death. It can lead to multi organ failure. It can lead, if it's not an ulcer, if it's not a perforation and it's just an ulceration, that leads to a chronic bleed, which leads to anemia that's even worse than what we're already at risk for as a gastric bypass patient. This particular patient ended up needing multiple surgeries and multiple blood transfusions. This is something that she is going to have to deal with the rest of her life. As I said, she had an orthopedic injury. As a gastric bypass patient, it is our responsibility to advocate for ourselves and to be educated. Yes, the orthopedist who gave her that prescription should have known this was not a safe thing for her. However, she wasn't sure if she had told them that she had a gastric bypass. A lot of times, when it's been years ago, we don't even think about it. We go to someone about something completely unrelated and don't mention it. Also, if it's something that healthcare provider does not deal with regularly, we're talking about a bone doctor. They don't deal with stomachs. Sometimes they don't realize the seriousness of it. The reason I wanted to talk about this is, as I said last week, I had foot surgery. My podiatrist, who is a foot specialist, was going to prescribe me NSAIDs. I had to speak up and say, no, I can't have that. I had gastric bypass. And he, who I have a tremendous amount of respect for, really didn't understand why. And I educated him about it and made him aware of the risk of it. So this is something that a lot of people don't understand. And as I said, this is not something I've just seen one time. This is something I have seen many times. And I will also say the other cause of these margin ulcers that only happen in gastric bypass patients is smoking. Smoking tends to irritate that suture line and cause these often life-threatening ulcers. So another reason we're told not to smoke. I think that we don't know how long of an exposure we have to these drugs to cause these, and it can vary patient to patient. Studies have been done at 30 days of daily use, but who knows? It can happen in less time, and I have seen it happen in less time. So guys, I just wanted to do kind of a PSA today about being aware of that. If you have a condition that requires you to take NSAIDs daily and you are pre-op and having a gastric bypass, take that into consideration. Talk to your healthcare team about what your options are going to be after surgery. And also, myself, when I weighed almost 300 pounds, I took meloxicam every day due to joint pain. After I lost almost 150 pounds, I don't need it anymore. So just know that tremendous weight loss may change what you actually do need. I would love to hear from you. Have you been told the true danger of NSAIDs after a gastric bypass? Was that explained to you? Is that something that you were aware of? I would love to hear video suggestions, questions, where you're at in your journey. I hope everybody has a great week, and I will see you next Wednesday. Bye.